welcome to PAINFrame. Today I have Dr. Mathew, and I'm your host, Staci, Becker, nurse practitioner, and we're going to talk a little bit about COVID-19 and what you can do to decrease transmission of this virus, as well as just updates on the virus itself.
Stace, thank you, and thanks for watching. A lot of patients have been calling and requesting more videos. Stacy, thank you for taking the time to make this happen. As I mentioned, our goals for PAINFrame is to get as much free content out to our patients and followers so they know what's going on in the world of pain. Right now, that's taken a big secondary stance to this viral outbreak that's happened. Thankfully, a lot of good news today. We're only 1 week into our isolation and social distancing, and the numbers are already looking good. Things are getting better in places like China, South Korea, and Italy even today they reported. Some of the simplest things you can do, I'm going to let Stacy take it away from here.
The best thing you can do, you heard it in the media before, is to just wash your hands and wash your hands a lot for 20 seconds at a minimum.
And you don't even need to use hand sanitizer if they're completely sold out. Soap and water work even better. Most people say, Stace, just sing Twinkle Twinkle Twice or Happy Birthday while the water's running. But that simple act can save a lot of lives. The other thing I tell you is if you're feeling sick with a cold or a fever, stay at home, call your doctor, they'll tell you what to do. If you are having a cold like you typically would, there's really no reason to go to the hospital. There's no reason to go to the doctor's office. If you're getting worse, absolutely go check in. But this will be a pretty small percentage, Stace. Most people who even do contract the virus will have a viral illness, which basically means cold and flu-like symptoms, cough, cold, fever, body aches. I'm sure sometime in the course of all of our lifetimes we had this. The other thing I would tell you is this idea of social distancing. It's awkward and scary for all of us. I think it's going to be a short period of time, Stace. What do you think?
You know, I think it will be too. They're saying stay away about 6 feet.
That's right. We're more than 6 feet away from each other.
Yeah, so my family's doing it at home. We're isolating ourselves from friends and family just so we decrease this virus.
Well, Stace brings me to a great question. What does a wonderful wife, husband, and 2 little kids do to entertain themselves at home and keep sane while we're not allowed to do a lot?
Yeah, we just have to get creative. We're doing a lot of puzzles, kind of homemade activities,
that's
art
awesome.
crafts.
That's awesome. You know, one thing one of my patients were asking me is if they couldn't come in for an injection or a procedure, what they could do at home, Stace.
To decrease their pain at home?
Yeah.
Well, they're at home, they're spending a lot of time probably sitting in the chair or standing or sitting longer than 30 minutes at a time. I'd recommend getting up, doing your exercises and stretching to decrease your pain. Also, moist heat, taking a towel, putting it in the microwave for about 20 seconds, placing it on your stiff or sore neck or your back. That can also help alleviate your pain.
You know, a lot of patients think heating pads and ice packs work, and they do in some cases, but the best way to treat an acute spasm of pain is moist heat. So a wet hot towel, Stace. Another thing I would throw in there, if you do have a tub, fill it up with some hot water, obviously make sure it's not on fire, Epsom salt, soak for 15-20 minutes. A nice hot shower can do wonders. Call us if things aren't getting better. We are open for business. We actually moved to the 6th floor at St. Luke's, so please give us a call. Another thing patients are asking is what they can do to stay healthy. One of the best things you can do to stay healthy is drinking water, exercising, taking care of your health, making sure your blood pressure is under control, your diabetes, if you happen to have that, is under control. Most of us, including me, are at least 10-15 pounds overweight. Shame on me. Intermittent fasting, when you can't get out, Stace has been a game changer for me. Basically, time away from food is wonderful. There are some supplements. I don't know, Stace, if you recommend. I know you're a big exercise, diet, yoga queen, so I'll let you give us some advice.
Well, just, you know, your vitamins, your multivitamin, vitamin C, vitamin D,
great.
Turmeric.
Yeah,
now,
all great.
There was an article you read the other day about tonic water.
Hey, absolutely. So tonic water, interesting topic, Stace, has a little bit of a compound called quinine. I can't take the credit for this. My mentor, Dr. Craig Dove, God bless him, introduced me to tonic water. It actually has an anti-inflammatory property and anti-malarial property. One of the medications they're actually using now for treatment of COVID-19 is related to a substance in tonic water. Now, don't go run out and buy liters of tonic water, because I don't think all of us need it, and it probably will give you a little bit of stomachache if you drink too much.
Yes.
YouTube family, listen, wrapping this video up, we are thinking about you, praying for you. As a country, as a bunch of wonderful Iowans, we're all going to get through this. I believe it's going to end sooner than we all expect, and hoping for a lot of good news by the end of the month. In the meantime, do the right thing. Listen to Staci. Keep your hands washed. If you're at home and you're not feeling well, it's a good place to be. I wish you and your families all the best.